Sharnita Midget is a clinical research and outreach coordinator at Penn Memory Center. She assists with the center's recruitment and retention into their research studies, as well as works to promote and disseminate brain health education. She is passionate about diversity in research and storytelling in medicine. And she'll be speaking first. And after her will be Felicia Greenfield, who is the Executive Director of the Penn Memory Center. He oversees clinical research operations at the center. He supervises master's level social work interns from the University of Pennsylvania School of Social Policy and Practice, and provides counseling and education about Alzheimer's disease and related dementias to patients and their families. So we're looking forward to hearing from them. Get your questions ready, and hopefully they'll be able to answer everything you wanted to know about the memory and the aging brain. Thank you so much.
Thank you so much, Mimi, for that wonderful introduction. And so now I'm going to share my screen with you all. Let me know if you can see my screen.
We do.
Okay. So good evening, everyone. As Mimi said, my name is Sharnita Midget. I am an outreach coordinator here with the Penn Memory Center. And today I want to speak a little bit about healthy brain aging. I want to start by talking a little bit about my background and some of the work that we do here at the Penn Memory Center. So I started at the Penn Memory Center as an editorial intern. Storytelling is a passion of mine, and I've always been interested in stories about people's lives. In particular, when I started interning here, I was really interested in stories of people living with dementia and those who care for them. So one of the stories that I originally heard when I first came here was that of Karen Wheeler. And right now I want to share that story with you today. When Karen Wheeler's mother, Vivian Wheeler, was diagnosed with Alzheimer's disease in 2003, she began a journey. As her mother progressed through the stages of Alzheimer's disease, Karen had to discover ways to work through emotional, physical, and mental challenges. She wrote a 3-part series that explored her journey. She discussed more than just her challenges, her daughter's feelings on caregiving. In part 1, she talks about the positive moments and triumphs that were the result of time spent closely with her mother. She explored her daughter's feelings as caregiving changes. In part 2, she reflected on how her mother's fall causes her to contemplate moving her mother into a nursing home. Her story wraps up in part 3, as she reflects on the financial struggles that come with full-time caregiving and the adjustment process of getting back into the job market after years of providing around-the-clock care for her mother. She wrote, "Knowledge is power. For me, it's important to share all I've learned and continue to learn about Alzheimer's disease with others who are caring for a loved one." So today I'd like to talk a little bit about who we are at the Penn Memory Center. I want to talk a little bit about what is the difference between Alzheimer's disease and dementia. I want to talk a little bit about mild cognitive impairment. I want to talk a bit about healthy brain aging, why it matters, and share some healthy brain aging tips. I also want to speak a little bit about brain aging research and the Brain Health Research Registry. And at the end, I want to save some time for thoughts and questions. Also, throughout this presentation, if you have any questions, you can leave them in the chat and we will get to them at the end. So first, what is the Penn Memory Center? The Penn Memory Center is a Penn medicine resource for those seeking services related to dementia and brain health. There are education, training, and support services provided by our clinicians, social work team, and communications team. For patients, research participants, and their families, we offer free counseling in person or over the phone, education about their diagnosis, emotional support, suggestions and referrals to local resources, and priority to our Penn Memory Center programs. So a lot of the conditions that we see here relate to dementia, Alzheimer's disease, and mild cognitive impairment. So now I would like to take the time to explain what they are. So first, what is dementia? Dementia is a broad term describing the loss of cognitive function, thinking, remembering, and reasoning, and behavioral abilities that interferes with a person's ability to function and do everyday activities. Listed here, you see several diseases that have dementia as a symptom, such as Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Signs of dementia can include memory loss, difficulty planning or problem solving, being confused about time or place, and problems speaking and writing. So 2 slides back, you might have noticed that Alzheimer's disease accounts for the most cases of dementia. Alzheimer's disease is an irreversible, progressive brain disease that slowly destroys memory and thinking skills. Some risk factors include age, family history, and genetics. And currently, there is no treatment available that slows the progression of the disease. So a very important takeaway that I would like you to remember from these slides is that Alzheimer's is a disease and dementia is a symptom. So now I want to talk a little bit about mild cognitive impairment, or MCI. MCI is a stage between normal cognitive decline that comes with aging and a more serious decline of dementia. Not all people with MCI will develop dementia, and some people will go on to live the rest of their lives with MCI. So as our brain changes as we age, some people may find it difficult to figure out the difference between healthy brain aging and dementia. So typical age-related changes include missing a monthly payment, forgetting which day it is and remembering it later, sometimes forgetting which word to use, losing things from time to time. Some signs of dementia include inability to manage a budget, losing track of the date or the season, difficulty having a conversation, and misplacing things and being unable to retrace steps to find them. So one thing we like to tell people who are concerned about their memory changes is that if you're having issues managing your money, taking your medications, using technology or transportation, that it may be a good sign to check in with a clinician. So why does brain health education matter? Why does it matter that I'm sharing all of this with you today? More than 5 million Americans are living with Alzheimer's disease. 15 million Americans are providing care for a loved one with Alzheimer's disease. 1 in 3 older adults die with dementia caused by Alzheimer's or another disease. African Americans are more likely to develop Alzheimer's disease, but are underrepresented in research. So here's an infographic from the Behavioral Risk Factor Surveillance System in 2015. In 2015, 1 in 5 adults were caregivers, 58% were women, 18% were 65 years or older, 37% were caring for a parent or parent-in-law, 10% were caregivers providing care for someone with dementia. And in 2015, they noted that 1 in 7 non-caregivers expected to become caregivers within 2 years. So that number has increased since then. Some questions to keep in mind as I move forward in this presentation. How does this affect our future and the future of our loved ones? What can we do for ourselves and to help those living with dementia? So now I want to talk a little bit about healthy brain aging. So this is an infographic that we recently created here at the Penn Memory Center. And one thing we would like for you to remember is the saying, if it's good for the heart, it's good for your brain. Healthy brain aging includes exercises and eating habits that can help keep us healthy as we age. So this includes cardiovascular exercises like walking, running, and dancing, and healthy eating, such as food recommended in the Mediterranean diet. So the Penn Memory Center has programs where we promote healthy brain aging. Some of our past programs included Dance for Health, which was a series of weekly dance sessions and social activities that promote brain health and healthy living among the West Philadelphia community. The program is free and open to the public. And in the past, it had been held at the first floor of the Ralston House. But recently, in August, we had 4 virtual sessions of Dance for Health. Also, recently, the Penn Memory Center has teamed up with the Time Out program to start a new 8-week virtual exercise program called Shake It Up. Participants met on Zoom at 1:30 on Wednesdays, beginning September 30th, and the program focuses on coordination, muscle activation, and meditation, and is open to members of the Penn Memory Center community. So this session was where I would ask people in person to show their hands if they like these different dishes. Obviously, we're doing this virtually. So I just want you guys to keep in mind if you've eaten these foods and how often you eat these foods. And the foods listed here are fish, chicken, beans, nuts and seeds, fruits, and vegetables. And here's an image of some dishes that you can make using the ingredients listed prior. I apologize if I'm making any of you hungry. I know it's close to dinner time right now. And so the dishes and ingredients that I showed you earlier are part of the Mediterranean diet. This is a diet known to be eaten in countries that border the Mediterranean Sea, and researchers have recommended the Mediterranean diet for healthy brain aging. Elements include dairy products, fish and poultry, fruits, vegetables, beans and other cereals, potatoes, nuts and seeds, use of olive oil, and wine consumed in low to moderate amounts. These diets have similarities with the American Heart Association's dietary recommendations. So now I want to talk a little bit about research and what it is. So while we know some lifestyle choices that may help us with healthy brain aging, research is one of the main ways we can better understand and learn more about Alzheimer's disease. Some Alzheimer's disease research studies can be observational, meaning researchers watch how our brain changes over time, or they can be treatment studies. So now you might be thinking, why should I participate in research? So here I've listed just a few reasons why you should participate. You will be provided with a comprehensive memory assessment that can help you understand how your brain health may be changing over time. Your participation directly advances research. You are helping future generations in the fight against Alzheimer's disease. We work to connect you with additional resources, such as recommending appropriate support groups. Your participation helps your community. By participating in research, you help us learn more about how different life experiences, backgrounds, and other factors impact brain health. At the Penn Memory Center, we have several research studies. One of our largest research study is the Aging Brain Cohort Study. This is an observational study that tracks participants from the moment they enroll until the end of their life and studies how their brain changes over time. We currently have approximately 400 participants. Data from this study is shared with researchers across the nation, and it is critical to help us understand how the brain changes over time. Those who are eligible for the study includes adults ages 65 and older, those with a reliable study partner, and those who are willing to have an MRI and PET scan. So that brings the question, what is an MRI? MRI stands for magnetic resonance imaging. It's a machine that creates pictures of the body using magnetic fields. For our studies, you go into the MRI machine for about an hour, and the machine can make some noise sometimes, so often you are offered headphones to listen to music while you're in the machine. What is a PET scan? PET stands for positron emission tomography. This is a type of imaging test that reveals how your organs and tissues are functioning. We use PET scans to measure amyloid plaque and tau tangles, two proteins that are associated with developing Alzheimer's disease dementia. Who is a reliable study partner? A reliable study partner is someone who can answer questions about your functioning, how you carry out your activities in your daily life, how your memory, thinking, and actions might be changing over time. A study partner is someone who will consistently attend research visits with you and support you throughout the study. So once you're eligible and meet all the criteria, you're enrolled into the study, and the question now is, what do you do as an ABC participant? So as a participant, you will come in once a year to meet with our staff for a 2 to 2.5 hour visit that includes cognitive testing, a neurological exam, blood samples, and an interview. So here at the Penn Memory Center, as I mentioned before, we really like to share the stories of our participants and our Penn Memory Center community. So recently we started an ABC newsletter that highlights the stories of ABC participants and also shares any news and updates from the ABC study. One of our participants who we highlighted was Julius Hayes, and I want to share a little snippet of his story with you guys today. For Hayes, being a part of research is valuable, something that he has time for, and something that he hopes will further scientific advancements. It's kind of just like a social thing that I feel like I have to do to help in a small way, he says. Hayes, Philadelphia resident and retired social work supervisor for the city of Philadelphia, has been a participant of the ABC study for 6 years. After 2 of his relatives and some of his friends' parents were diagnosed with dementia, he was motivated to join the ABC study in 2013. He met former Director of Diversity and Research, Tikas Taylor, who focused on diversity and recruitment into the ABC study. She focused on increasing the numbers of African Americans in our research studies, a cause that Julius Hayes wanted to support. In reflecting on the triumphs and failures in research, Hayes talked about the journey that research has taken and how it has grown. He said, "I would recommend it. Without research, we wouldn't have the advances that we have now." So for those who are interested in signing up for our research studies, the best way to show your interest is to sign up for our Brain Health Research Registry. Our research registry is a list of names and contact information from people who are interested in research studies. Once you sign up for the registry, you're added to our mailing list and you are sent updates on our news and on changes that are happening at the Penn Memory Center. You are also contacted by a research coordinator if you are eligible for a study. Those who are eligible include older adults who have a study partner. So this can be a spouse, adult, child, or friend who knows you well. And those who are eligible also include someone willing to take part in imaging, so MRIs and PET scans. If you are interested in studies, you can sign up at pennmemorycenter.org/registry. You can also learn more about our studies at pennmemorycenter.org/research. Also, if you are interested in employment opportunities with the Penn Memory Center, or if you know someone who would be interested in this work, you can find out more at pennmemorycenter.org, or you can reach out to me at the contact information listed here. So the best way to reach out to me is via email, but my work cell phone number is listed here as well. And I want to thank you so much for listening to my presentation. Now I want to open the floor up for any questions or thoughts that anyone may have. I do want to add that if I don't have the answer to your question, I most likely know someone who can answer your question.
Thank you, Sharnita. And I'm going to remind everyone, please use the chat function, or if you'd like, raise your hand in Zoom, and then that way we can unmute your account and then let you ask the question directly. We did get some in the chat box ahead of time. Uh, Somebody asked, how can I get more information about programs like Dance for Health?
So the best way would be to contact me. So I know a lot about these programs as the outreach coordinator, but you can also find out more on the Penn Memory Center website.
Somebody asked, will you email a copy of your presentation after the end of this?
Yes, I can definitely email a copy of this.
Great.
Actually, I'm gonna add my email address to the chat now. Make it easier for anyone to contact me.
Somebody asked, with MRI and PET scan, why would people have one or the other?
So an MRI is more for images of the structure of the brain. A PET scan is more for seeing how much amyloid plaques and tau tangles that someone has in their brain. So while they are very similar, they are looking at different things in your brain.
Another question is, how is Alzheimer's disease diagnosed? And I suppose that could be generally or specifically at the Penn Memory Center.
So that is something more for a clinician to answer, but I think the best thing to do would be to reach out to your clinician, let them know your memory concerns, and you can do an evaluation from there.
I think actually too, if you don't mind, perhaps we can send that one over to Felicia, our executive director, and then we can finish up here before we move on to her presentation.
Mm-hmm. Let's see.
So to answer the question about how we diagnose Alzheimer's disease, first and foremost, there's a clinical presentation that the doctor listens to, the story, if you will, of how what is going on in the daily life and functioning of the individual with memory concerns. Oftentimes the person with the memory concerns is not aware of them, and so it's usually family members who interact well with the person with the memory problems who at some point realizes that there's something going on here. Something just doesn't seem right. So when a family comes to the center, the initial visit is done in two parts. The first half of the visit, the patient, the person with the memory problems, is in a room with a tester, and the tester does some pencil and paper tests of memory, thinking, language, and cognition. And while that's happening, the doctor, the clinician, is interviewing the family member to get their impressions of what's happening with the family. So we have a clinical presentation combined with testing scores. So those are two parts of the diagnosis. And then after the doctor has those two data points, we ask the person with the memory problems to have an MRI of the brain. And we look at the MRI and we're looking for hippocampal volume, which is an indicator of memory loss if it's shrunken. We're also looking for other things that might be causing the memory problems, like stroke or a malignancy, a tumor, something of that sort. So then the team gets together every Monday morning and we talk about the cases. So the clinician is presenting the story, the case that they heard from the patient and the family, along with the test scores, so we're interpreting test scores, and then we look at the results of the MRI. We look at the brain images of the MRI, and together it's a consensus of clinicians that agree what the most likely diagnosis would be. We never know with 100% accuracy until after death. And so autopsy is also another important piece to kind of compare what the doctors, the clinicians thought was causing the Alzheimer's disease or the memory problems versus what is actually going on in the brain that we can only find out post-mortemly. So I will mute myself and
Great, thank you, Felicia.
Thank you.
Sharnita, another question for you is, does MCI advance with age?
So those with mild cognitive impairment may live their entire lives with mild cognitive impairment. So it does not necessarily have to advance to dementia.
And another question, are certain ethnic groups at a higher risk of developing Alzheimer's disease?
So African Americans are 2 times more likely to develop Alzheimer's disease.
Somebody asked about the ABC visits. With you mentioned coming in every year for a visit. Are people coming in for visits now?
So visits now are being held in a mix between virtual and in person. So people are doing their testing and their exams virtually, but they're coming in for their imaging visits. So for their MRIs and PET scans, they're coming into the hospital. When they are on the scanner, they're wearing their mask the whole time. We are limiting the amount of people who go on the scanner. So there's an hour between each person where the scanner is cleaned and things are set up for the next person. So it's kind of been a mixture of both. And we've seen several people coming in for imaging visits so far.
Great, thank you. And the last question I have in my queue here is what happens when I join the registry?
So when you join the registry, you get an email that welcomes you into the registry, and then you're added to our mailing list. So on once a week, you will receive a newsletter from us giving you updates about the Penn Memory Center, the latest research, latest findings, information from the Penn Memory Center. And then if you are eligible for a study, you will be contacted by a research coordinator who will talk to you further about your eligibility. And if you meet the criteria for a study, then you will be enrolled.
And I'm sorry, we got a couple more in here, and then I think we'll close out right around 7:10 for the sake of time. And if I can also expand to, we will send a recap of the presentation to people who were on the list. And certainly you can respond to that email with any additional questions, and we'll make sure we address them after the presentation. But one question in here says, can you slow down MCI?
So I think that question would be better for a clinician to answer. Felicia, do you think that you would have more information about that?
That's actually in my presentation, so I'll be getting to that in just a couple.
Okay.
Okay. There are a couple of other questions that I also think would be more appropriate for Felicia's presentation. So perhaps I'll hold on to those, and then we can close the Q&A for now and open it back up at the completion of Felicia's presentation.
Okay, sounds good.
Should I pull up my slides? Or at this point, Sharnita? Okay. First of all, I want to say great job, Sharnita. This is the first time we've ever presented together, so it's fun to be here with you tonight.
Thank you so much.
So I am pulling up my slides to share with you. Okay. So good evening. I am Felicia Greenfield. I'm a licensed clinical social worker at the Penn Memory Center. And I'm involved with a lot of different aspects of the center, but my primary focus tends to be on supporting caregivers of the patients that are being treated at the Penn Memory Center. So that is my area of expertise. And I do talk a bit about healthy brain aging. There may be a bit of overlap between what Sharnita just talked to you about and what I'm going to talk to you about. So if it does sound redundant, I apologize in advance. And we can kind of skip through anything that maybe is too much of a redundancy, and then we can get to the questions and answers. So again, let's see in the peak. I mean, in the chat, kind of people who want to take a stab at the answer to this question. When do we peak cognitively? At what age? And I can't see the chat. So Terry, if people are throwing numbers out there, will you tell me?
Well, 26 is our first guess.
All right, good answer.
40, 45, 25, 21.
All right, y'all are in the ballpark. So our short-term memory peaks around age 20. So our ability to take in information and encode it peaks at around age 20. And unfortunately, it's mostly a slow decline from there. So sorry to be the bearer of bad news. Our short-term memory for recognizing and remembering people's faces peaks in early adulthood, but begins to decline at around age 30. And our vocabulary tends to improve in our 40s and get better over the course of the lifespan. As well, I don't have on the slide, but wisdom is another area of cognition that continues to grow and develop into adulthood. But we really are, in terms of short-term memory, it is something that is a gradual decline from the time we're quite young. So I'm going to use this term successful aging. We use healthy aging and normal aging. I think successful aging is something that I want to show you on this graph. So this is our cognitive function, and this is age over time. And this green bar right here represents normal aging. So that's, in Sharnita's slide, she talked about signs of typical aging: forgetting the day, but then remembering it quickly, forgetting a word, just these kind of minor blips that we all experience. That is really nothing to be concerned or alarmed about. That's all part of normal aging. This red line, we see a continuum. Sharnita talked about this mild cognitive impairment. And mild cognitive impairment, as she described, is it's a change in a person's cognition from baseline functioning, but it is not severe enough to be considered dementia. It doesn't meet the requirements of dementia. And so this is still within the realm of normal aging. And then when you see this kind of decline right here, that's the mild cognitive impairment stage. It's a relatively new diagnosis in the past, 15 years or so. And the way clinicians describe mild cognitive impairment to patients is that different things can be causing the mild cognitive impairment. So depending on what's causing those mild problems in memory and thinking determines whether it'll get better, stay the same, or go on to become dementia. And about 10% of the population who has a diagnosis of mild cognitive impairment will continue in the next year to keep that diagnosis of mild cognitive impairment. About 10% of those individuals with that diagnosis will get better, in fact, because the mild cognitive impairment might be caused by a sleep disturbance or severe depression or anxiety that, if is treated, can improve. It might be caused by a thyroid deficiency. So there are treatable medical things that can make that mild cognitive impairment reverse and go back to normal aging. But if a neurodegenerative process in the brain, such as Alzheimer's disease, if that's the leading cause of the mild cognitive impairment, those people, 10% of those people will go on to develop dementia in the following year. So I hope that answers your question. And if you do have questions, put it in the chat and I'll try to address it at the end of my talk. So the blue line here represents people who are those people who you would say are 90 and sharp as a tack. They're really not even showing signs of, what is considered normal aging. Those are our super agers. And researchers are trying to figure out what is their secret. How do we get to be a person who successfully ages and has very little decline over the years? So first we want to talk about risk factors. There are protective factors and there are risk factors. And some of the risk factors we can change. There are things that we can do to change our risk factors, but there are also risk factors that we cannot change. So when we're talking about risk of developing Alzheimer's disease, things we cannot change are our age. And our age is the leading cause of Alzheimer's disease, the biggest risk factor for Alzheimer's disease. So we consider older adults like 65 and older, but the older you get beyond that number, the more likely you are to develop Alzheimer's disease. Women tend to be at greater risk of Alzheimer's disease. Somebody asked me in the chat earlier if it's hereditary. And so we see that family history or genes plays a role. It is a risk factor, but it doesn't mean that it's absolutely going to develop into Alzheimer's disease. There have been lots of studies done that look at family history over time, and there are people who have the genes for Alzheimer's disease. It's ApoE4. If they have 2 copies of ApoE4, that increases the risk. But not every person who has the risk factors goes on to develop dementia. And conversely, there are people who carry the gene who never go on to develop dementia. So it's a risk factor, but it is not a certainty. Head trauma is a risk factor for Alzheimer's disease. And that's, once we have significant head trauma, like if we're an athlete, we can't reverse that, but we can take precautions to prevent head trauma throughout our life. People who live unhealthy lifestyles are at risk. So what do I mean by unhealthy lifestyles? People who who don't exercise, who don't eat a healthy diet, eat a lot of fatty foods. People who smoke or drink excessively are at risk of developing Alzheimer's disease. So that's another risk, but that's a modifiable risk factor. If people reversed their habits, they could be protective against Alzheimer's disease. And then being Black or Latinx, as Sharnita mentioned. And the reasons are not fully understood, but researchers think that it's the vascular risk factors in those populations that lead to Alzheimer's disease. So I often get this question, especially from our caregivers, what can I do to delay cognitive decline in older age? In addition to working at the Memory Center, I teach in the School of Social Policy and Practice at Penn. And when we're training social workers, we talk a lot about self-care. And so I often use this dimension of wellness wheel with them to try to get students to examine their own wellness. So in the emotional realm, intellectual, physical, and I would include diet in there, their social well-being, environmental, financial, and spiritual. So this is kind of, just a reminder to all of us that these are areas in our life that can lead to us having a better sense of well-being. But specifically when it comes to cognition and brain aging, we focus on 5 lifestyle changes. We look at physical exercise, nutrition, cognitive stimulation, social engagement, and mood management. And so I'm just going to go through these each a little bit to give you a bit more. So exercise has been probably the most researched and shows the most improvements in cognitive functioning. We recommend about 30 to 45 minutes of rigorous aerobic exercise a week. And doing this, and this has been well studied, looking at with testing and MRI, and it has shown that people who do exercise 3 to 4 times a week have better executive function. And executive function is like attention and cognitive flexibility, the ability to make a plan and follow through with the plan. It also helps with attention, processing speed, and motor function. Other benefits of exercise is that it helps mitigate diabetes, and just is overall lowers your vascular risk factors of developing cognitive impairment. It also improves your ability to do the things you want to do. It improves your physical function, and it helps reduce depression and stress, and actually improves mood and overall well-being. So on the slide that I showed you a couple slides ago, it says that mood management is important. And mood management, there's a direct link between physical activity and mood management. We also talk about cognitive stimulation. So we want you to move your body. We want you to stay stimulated cognitively. Many people think of crossword puzzles, and our answer is, if you like crossword puzzles, do crossword puzzles. But if you don't like crossword puzzles, do what you like to do and do more of it. So if you don't like doing a crossword puzzle and you think you have to do a crossword puzzle to keep your mind sharp, you'll probably get frustrated because you don't like doing them, and you probably won't do it for much longer. So whether it's reading or playing cards or playing a game, talking to a friend, having a rigorous conversation, taking classes. There's been lots of classes available to people online during this time. Those are some things that you can do to keep your cognition sharp. Sharnita already talked about a Mediterranean diet. She did a beautiful job going into it, so I won't talk on this much more, except that diets that are high in protein are helpful for cognitive function. Social connectedness. We want people to stay socially engaged with family and friends. We want people to be a resource, be a mentor, maintain positive relationships with people. And another way to stay engaged is through volunteerism. Volunteerism helps give people a sense of meaning and purpose, which also boosts and elevates one's mood. And it also, it helps others to feel good. And when you do something that takes you outside of yourself, and when you're giving to others, you also get a reward back. So lifestyle changes, the combination of all of these things, I don't want you to think about just picking one. So, thinking about an activity that you enjoy. These are some guys who are going swimming, so that's physical activity, but they're also doing it together. So they're meeting that social engagement piece. And here's a woman sitting outside, taking in nature while reading a book and having a glass of wine for relaxation. So the combination of all of these things is more effective than any of these factors alone. Just something to keep in mind. So you're rounding out your kind of dimensions of well-being. Sharnita also did a great job talking about what we do at the Memory Center. Clinically, we do the diagnosis that I described to you earlier. We offer patient and family and community education, such as this community event. We have a portfolio of research studies for which you can register for through Sharnita's registry. And the social work team, my team, has a whole host of support programs for caregivers. We teach classes on caregiving. We have support groups and online forums. We're holding those twice a month. Time Out is a respite program that matches college students with older adults and is set up to be kind of a buddy or mentor program. But of course, during COVID, we're not sending students into the homes of older adults. So we've modified this to something called Weekly Smiles. And it's just a virtual platform where a student and an older adult will Zoom in and just have a conversation, or just some ways to spend time together. We have counseling. My team offers counseling and support. Time Slips is a new program. And so I think an announcement went out earlier this week. It's a story. It's a way to engage patients in a narrative. And so using a prompt to engage dialogue. And that's something that a patient and a caregiver can do together, because the idea is that once the caregiver learns how to engage the patient in this way through the virtual event, they'll be able to maintain that at home. Creative expression through music is a partnership with the Curtis Institute, which is a conservatory of musicians, and they are partnering with our patients and caregivers to talk about music, listen to music, and then actually write a narrative, or kind of dictate a narrative of their life that is important to them, that gets translated into a musical piece that the Curtis students will compose for them. And then of course, Sharnita spoke to Dance for Health. So those are some of the specific programs that you can take advantage of if you are affiliated with the Penn Memory Center through clinical or research participation. And that is all I have in terms of slides. So I will take questions if there are any.
We had quite a few come in the chat, and I shared some of them with you, Felicia, here, but I'll also start. Someone asks, can anyone volunteer for the Time Out Weekly Smiles program?
Yes, anyone can volunteer. If you're a student and you want to volunteer, you can volunteer to be a participant in that way. If you're an older adult, yeah, it's open to anyone in Philadelphia or the region. It doesn't have to be a patient of the Penn Memory Center.
Is it true that those who eat a lot of fish tend to avoid dementia and Alzheimer's?
So it is true that people who eat a lot of fish are reducing their risk factors and setting themselves up to be successful agers. But I will say, and I should have said this earlier in my presentation, that sometimes no matter what you do to prevent Alzheimer's disease through your lifestyle changes, exercise and diet, sometimes the genes will dominate. And sometimes those activities that you do, those behaviors that you engage in, can delay onset. But if you're a person who is eventually going to develop Alzheimer's disease, it's not a prevention, it's just a delay.
You addressed successful aging in the beginning, and does successful aging in years vary between individuals, or does it tend to be around the same time?
I think it means over time, a person who is a successful ager over time will stay above the curve of even healthy aging. I think that the decline is not very steep at all. It's a slow, gradual decline. And so I would say that throughout the lifespan, these people tend to do better than even the people who are considered healthy agers. And I don't know if I answered that.
Following up with that, then, so when people is there an age when people tend to fall into the category of MCI and dementia, or does that vary?
That varies. The average age that we kind of use as a marker is 65. 65 is it's arbitrary, but that is what's considered an older adult. But we certainly see people who are younger than 65 who have diagnoses of either mild cognitive impairment or Alzheimer's disease. And certainly, just because we say 65, it doesn't mean that when you turn 65, you can expect to have memory problems. That's just a kind of an average aggregate number for when we see these problems starting to happen. Certainly, it can be, you can start having signs of MCI at 85 as well.
what do you recommend to someone who knows that their mother is having issues but refuses to get tested?
That's a toughie. So like I said earlier, it's often the person with the memory problems who doesn't have insight into those problems and doesn't recognize it. And oftentimes there's a real fear. And so people are reluctant to go into the doctor to get a diagnosis. And so it's, people use different methods. One method that I recommend that seems to work for families is it not to be you, the adult child, who's telling their parent that they're noticing these problems, but maybe to have the information or the concern be expressed through a good friend, or even a trusted family doctor. And sometimes the person is more likely to take their friend or their doctor, their advice more than their adult child's advice.
Do you need to be under the care of a neurologist when you come into the Penn Memory Center?
No, in fact, our team is multidisciplinary and comprised of different disciplines, and we lump those disciplines together under memory specialist. So people who are memory specialists can have backgrounds in neurology, gerontology, or psychiatry, and any physician in those practices who goes on to do additional training in Alzheimer's disease and related dementias is considered a memory specialist. So I would say that either of those disciplines are fine as long as they consider so when you're making an appointment, you want to make sure that the person has extensive training and background in the dementias.
There are two related questions on brain injury. One, just head injuries in general, but also traumatic brain injury. Does having TBI make someone ineligible for research? And then if someone does have TBI or a head injury, can that cause dementia, and is it reversible? So yeah, okay. Participation research, and then does it cause dementia, and is it reversible?
So we're doing Alzheimer's disease research. All of our research is geared at trying to find a prevention or a cure for Alzheimer's disease. So when you're enrolling in a research study, we have to be sure that what's causing the memory problems is Alzheimer's disease pathology. So TBI would be an exclusion, a traumatic brain injury would be an exclusion from research in our Alzheimer's disease studies, just like significant depression would be anything that would confound the findings. We want to make sure that that the drug is targeted towards what's causing the memory problems. So, yeah. Was that clear, Terry?
Yep.
Okay.
Is there any way to find out if you have a genetic risk?
Yes, there is a way to find out if you have a genetic risk. There are a couple different ways. So there's the commercial 23andMe that people often do, but we don't recommend 23andMe because it doesn't come with any kind of education or support around the results that people are learning. Another avenue people can explore, which would be the recommended avenue, would be through a genetic counselor. The caveat to a genetic counselor is that before they'll test an individual for genes that put you at risk of Alzheimer's disease, they'll need your parent who has symptoms. So what comes first is, for example, if my mother had Alzheimer's disease and I wanted to know if I was at risk, my mother would be tested first. They would do a gene panel on my mother to find out what the genes are before they would be able to run it on me. And so let's say they did find that my mother has confirmed carries the gene for Alzheimer's disease and she has Alzheimer's disease. then they would want to talk to me. Then there would be a counseling session with me to find out why I want to know and what I would do with that information, because there are implications for knowing that information, potential discrimination for health insurance or employment, for example. And also it could result in increased worry or depression or suicide ideation. So the genetic counselor would interview me to find out why I wanted to know this information, and then they would make a determination whether or not they'll approve me for that test. So yeah, so two avenues, and that's the question I think you would want to ask yourself before you even went down that road is, why do I want to know, and what would I do with that information if I had it?
Are there any programs from the Penn Memory Center in the surrounding counties of Philadelphia?
In non-COVID days, no, everything is done at the center. But now that everything is done remotely, so anyone can call in and take advantage of our programs. And we'll probably, my prediction is that once we're back in person, we'll continue to offer online programming as well, now that we know how to do it.
Somebody asked if you could expound upon vascular risk factors. You mentioned that there are such things. What would that look like, and how would they address them?
So vascular dementia, that's another form of dementia, is caused by white matter in the brain. So people think of that as hardening of the arteries is the way it used to be thought of. So vascular risk factors, when we look at an MRI, sometimes we see mini strokes. People have had mini strokes that may have gone unnoticed, but that causes some white matter in the brain that leads to vascular risk factors of dementia. Other vascular risk factors are high cholesterol, hypertension, and diabetes. People with those health conditions are at increased risk of developing Alzheimer's disease. The good news is if those things are detected early enough, they can be treated, and that could be a protective factor against vascular dementia.
Does having type 1 or type 2 diabetes exclude you from being eligible to participate in research?
That is a question that I don't know the answer to. Many of the studies have different inclusion and exclusion criteria. If you're looking for, like the ABC study, for example, I don't think that would be an exclusion at all. So I think that would be a study-specific question. So I wouldn't let type 1 or type 2 diabetes prevent you from signing up for the registry, because you would be informed of all the different studies that way.
How do I get my dad to stop driving?
That's the $1 million question. So in Pennsylvania and New Jersey, doctors are required to report people with any condition that would make it dangerous for them to be on the road to the Department of Transportation, or PennDOT. Epilepsy can be one of those conditions, but certainly Alzheimer's disease is one of those conditions, because it impairs one's ability to make decisions on the fly, all kinds of reasons why people with Alzheimer's should not be driving. So this is what we do. We have these conversations, these difficult conversations, and we give people three choices. We say, your first option is just to surrender your license. That is psychologically sometimes the best way to go, because it puts the person in the position, it empowers the person in the position to make the decision him or herself. That works sometimes, doesn't always work. The second choice is to have an independent driver evaluation. There are occupational therapy centers such as Moss Rehab or Bryn Mawr Rehab or Fox Rehab that will do a pencil and paper test with a person. It has to start with a referral from the physician. So from a geriatrician or a memory specialist who doesn't think the person should be driving. So the person will take a test and then get behind the wheel, and the occupational therapist will make the determination whether or not the person needs to stop driving or can maybe continue driving but be reevaluated in 6 months. Now, these driver evaluations cost about $400. And most likely, more times than not, when we submit the referral and put a diagnosis of memory loss, that they don't pass. And so psychologically, it can be damaging to people because they failed the test and now they're out $400. And they are often angry. But that's option B. Option C is if they refuse to stop driving on their own and they don't want to go and have the driver's evaluation, and they've been seen at the memory center, the doctor who has seen them is obligated to report them to the state to begin the process of revoking the license. So that's how we handle it. I don't know if whoever asked the question is a patient at the Penn Memory Center. If so, we can be the bad guy for you, or you can just have that conversation with those 3 options with your father.
If someone is not a Penn Memory Center patient, does a family member have any power to force it?
If the person is if they have power of attorney, then they do have the power. But if they're not power of attorney, no, they do not. Just like on this topic, I will tell you that sometimes when you tell someone, if you're trying to convince them, one thing you can tell them is that if they have a diagnosis anywhere in their medical records of a memory problem or dementia, and they're in an accident, they will be at fault and they could be sued. And so sometimes that is a scare tactic that works for people. But it's really in the best interest of the person behind the wheel and everyone else on the road for people with these problems to not be driving.
It's another easy question for you. How do you open the conversation when you think your loved one may have dementia or Alzheimer's disease?
I would say it depends on the relationship, and it depends on the person. If the person, but I would always approach every difficult conversation when the environment is calm, when the 2 of you are together, or a family of loved ones is together, and the mood is relaxed and not tense. You don't want to, yell that you think there's a problem. You want to do it in a gentle, kind, loving way, and tell them that you're noticing some problems, some repetition. It's concerning to you as someone who loves them, and would they please consider going in to have a memory evaluation, and that many people that will be enough, and they'll say, oh my goodness, I didn't realize that, but I believe you and I trust you, and yes, I'll do this for you. And other people absolutely will refuse. And so that's when you sometimes have to employ another trusted professional into the conversation.
Another question asks, if a deceased relative was determined to have Alzheimer's, it says, should I have this study? But I guess this could be about a genetic test or participating in research. A general question of course of action if a relative was determined to have Alzheimer's disease. Do you have any recommendations?
Meaning an autopsy finding? Or we're talking about deceased relative?
I'm not sure, but it does say deceased relative, so.
So maybe the question, maybe I can interpret it as if the person has confirmed Alzheimer's disease on autopsy. If you are 65 or older and are concerned because you have a family history, I think, one of the best things you could do is join the ABC study as a normal control. That is a person who doesn't have any symptoms, but is concerned because a loved one has passed away from this illness. So in that ABC study, we'll do an extensive workup of your memory and thinking before you have symptoms, and you'll see the results of your study, of the testing. We do ask normal controls to have the MRI and the PET scan, but we don't share the results of those studies with people who don't have a diagnosis or any symptoms. And the reason for that is because they're research, they're not clinically proven yet to be definitive. And so we don't feel like it's accurate clinical data to present. However, we have that data. And if and when you do go on to develop symptoms, we would, if you had a diagnosis of mild cognitive impairment or Alzheimer's disease, then we do share the results because you're symptomatic. But to enroll in a longitudinal study when you're 65, some people are in our study for 15 plus years, and we have rich data on these people longitudinally and can detect changes early on.
Do you have any books or other resources that you sort of go to recommendations for caregivers?
Well, I do, but it depends on if you're looking for fiction or nonfiction. I think for information, if you're looking for information, one of the most comprehensive places to get that information is through the Alzheimer's Association website. They have a wonderful section for caregivers that has many, many statistics, data points, a lot of education for caregivers. So I would say I would recommend that website. In terms of books, there are so many. In fact, Terry, you and I should put together a reading list of fiction and nonfiction that we can distribute to the people on this call and in general. But if you're looking for a nonfiction book, there's a book called Still Alice. That is, and there was also a movie called Still Alice that is a book, a fiction, a work of fiction. A book called A Curious Kind of Widow. That's a personal narrative. It's a memoir of a caregiver who took care of her husband over a period of years. Another book that I would recommend that is Dementia Reimagined by Tia Powell. And this is about our approach to caring for people with dementia as a society and a healthcare system. And then also a great go-to book for caregivers is Ambiguous Loss by Pauline Boss. This is a great book that talks about the loss that you experience while your loved one is still alive.
You mentioned joining the ABC study as a normal control, but would you recommend the study for someone diagnosed with MCI?
Absolutely. If somebody has a diagnosis, that's in fact our group that we're trying to we would like more people with MCI in our study. The study accepts people with normal cognition, people with mild cognitive impairment, and people with dementia. So any person in that category, in those categories, are welcome to join our ABC study.
Unless any other questions come in at the final, I think we drained the well here. A lot of really good questions from people, but I think we can officially close this segment. But remind people that you are more than welcome to respond to the email after the event with any follow-up questions, and we'll make sure we get them addressed. Sharonita?
So I'd like to thank you all for coming out tonight. I know that Mimi had some closing remarks, so I'd like to turn it over to her if she is able to get on. If not, we can do the speakerphone again.
All right, can you hear me?
Yes.
Yes. I realized that I was on the conference call and the Zoom portion of it, and both of them weren't working together. So that's technology for you. Thank you for your patience. I just wanted to do a few thank yous. I know some people came on later that weren't on in the very beginning. So wanted to definitely thank Penn Memory Center for being available, Dr. Casey for always being supportive and wanting to get the information out to the community. Definitely wonderful working with Sharnita, meeting with her. Appreciate that, as well as her presentation. And Felicia, thank you so much. I have several of our committee members that still log on to the care givers forums that you offer twice a month. So thank you for offering so many services to the community. Just wanted to thank our chapter president who had RSVP'd, so I'm not sure if she actually made it on, but just in case, our chapter president of Omega Omega, our program chairman, who's also the first vice president, my co-chairman, Whitney Payne. I want to thank her and my committee members for always supporting and being present for these events and forums, and wanted to give our Care for Caregiver email in case anyone wants to contact us to nominate someone in the community who's a caregiver, or if you have any questions for what we may be able to partner with other agencies and other communities to help get the word out about giving care for caregivers. So our Care for the Caregiver Committee email address is care for, spelled out FOR, caregivers @gmail.com. And that's how you can reach Whitney or myself, and we'll pass the information on to our chapter. Also, before we finish, again, for those who have called in, I wanted Sharnita to give her email address, and perhaps Felicia, you as well, so that people can follow up if they're not seeing us through video once I'm all done. So that was basically everything that I wanted to share. Terrence, are there any other questions or anything else that you wanted to share before Sharnita and Felicia gives their email or contact information?
No additional questions. We had a couple of notes in the chat thanking Felicia and Sharnita, and I'll extend that as well. I appreciate both of them coming out, and I appreciate Mimi and the rest of the committee and all of our guests today. This was a terrific event, and we were recording it, so we'll be able to snip it into some useful bites, and we'll be sure to share that with you and allow you to distribute it however you would like.
Wonderful. Thank you so much. I'm sure everyone wasn't able to get on tonight with other obligations in life as it is. So certainly whoever RSVP'd, that's who you're planning to share the information with. Is that what I'm
Absolutely
understanding? Okay. All right. Well, that would be wonderful. I'd love to receive that as well. All right. So if Sharnita, if you could share your email, and Felicia as well after that, I guess we'll be all done. We'll let you enjoy the rest of your evening. Thank you everyone for participating and being interested in memory and the aging brain.
Okay. And for those who are on the phone, my email address is Sharnita. So that's SHARNITA.midget, MIDGETT, @pennmedicine.upenn.edu.
Okay, and I put my email address in the chat, but for those of you who are on a phone, it's felicia.greenfield. So that's FELICIA .GREENFIELD @pennmedicine.upenn.edu. And I think I might win the award for longest email address. Thank you all for being here. It was a nice way to spend the evening.
Yes, thank you all so much.